Before we begin today's video, let's practice a bit of mindfulness. Firstly, look at the screen, then slowly close your eyes. And as you do, just leave your mind blank. Then, take in a deep breath through the nose, slowly, then out through the mouth. One more time, in through the nose, and out through the mouth. And one last one. Now slowly open your eyes, and let's begin today's video. I will briefly describe each part of the eye on the diagram displayed on the screen, from the ciliary body to the oris aurata. The ciliary body. It's a part of the middle layer of the wall of the eye. It's found behind the iris and includes the ring-shaped muscle that changes the shape of the lens when the eye focuses. It also makes the clear fluid known as the aqueous humor that fills the space between the cornea and the iris, and its function is to nourish the eye and keep it inflated. Following up on talking about the ciliary body, this picture shows us a closer look at the ciliary body and shows kind of like the color of it. And as you can see there, along with the other parts of the eye, there's the ciliary body is the whitish part there, whitish grayish part. It's not that clear, but I would say it's whitish and gray. The iris. The iris is the colored part of the eye that surrounds the pupil. It's one of the most visible parts of the eye, along with the sclera. And its main function is to control the size of the pupil and also the amount of light entering the eye. The pupil. The pupil is a hole located in the center of the iris of the eye that allows light to strike the retina. It appears black because light rays entering the pupil are either absorbed by the tissues inside the eye directly or absorbed after diffuse reflections within the eye that mostly miss exiting the narrow pupil. In shorter words, the function of the pupil is to regulate the amount of light that enters the eye. The sclera. The sclera, also known as the white eye of the eye, is a strong tissue that wraps around the eyeball. It helps maintain your eye shape and protects it from injury. The anterior chamber. The anterior chamber is the front part of the eye between the cornea and the iris. It allows us to view the world and at the same time protect the eye from external impacts. It acts as the eye's windshield, per se. The cornea. The cornea is the outer clear round structure that covers the iris and the pupil. The cornea directs light rays into the eye and helps focus them on the light sensitive retina at the back of the eye, providing sharp, clear vision. The retina. The retina is a layer of photoreceptor cells and glial cells within the very back of the eye that captures incoming photons and transmits them along the neuronal pathways as both electrical and chemical signals for the brain to perceive a visual picture. The macula. The macula is part of the retina at the back of the eye. It's only about 5 millimeters across, but it's responsible for our central vision, most of our color vision, and the fine detail of what we see. The lens. The lens is located behind the iris and is normally clear. Light passes through the pupil to the lens. Small muscles attached to the lens can make the lens change shape, allowing the eyes to focus on near or far objects. The vitreous body. The vitreous body sticks to your retina at the back of your eye, and it's responsible for generating the vitreous fluid, or humor, more scientifically spoken. And this fluid fills the anterior and posterior chambers of your eye. The vitreous humor provides strength nutrients to your eye and helps your eye keep its shape. Just to be clear, it's called the vitreous humor, not the vitreous fluid, but it's a fluid. So yeah. The ophthalmic artery. The ophthalmic artery is an artery of the head. It is the first branch of the internal carotid artery, distal to the cavernous sinus. Branches of the ophthalmic artery supply all the structures in the orbit around the eye, as well as some structures in the nose, face, and meninges. The optic nerve. The optic nerve is comprised of millions of nerve fibers that send visual image messages to your brain to help you see. You have an optic nerve at the back of each eye that connects directly to your brain. Each optic nerve is a one-way connection and only carries signal from your eyes to your brain. Some of the signals in the optic nerve also contribute to other abilities and brain processes. Fun fact, the optic nerve also contributes to certain eye reflexes and your circadian rhythm, which is your body's internal clock. That's why sometimes you have jet lag if you go from different countries to another countries. The ophthalmic veins. The ophthalmic veins and the central retinal veins drain blood from the eye. These blood vessels enter and leave through the back of the eye. The rectus medialis, or medial rectus, is a muscle in the eye. Its main function is to move the eye inward towards the nose. And this is because of the nose's anatomical position and attachment to the eye. This movement is essential for coordinating both eyes to focus on the same point, allowing for proper binocular vision and depth perception. The oris aurata. The oris aurata is located where the retina, the light sensitive part at the back of the eye, meets the ciliary body. The oris aurata marks the transition between the part of the retina that detects light and the part that does not. As you saw in the title for Chapter 2A, I will now briefly describe common eye illnesses. Conjunctivitis, commonly known as pink eye. Conjunctivitis is the inflammation of the conjunctiva, the thin membrane covering the white part of the eye and the inside of the eyelids. It can be caused by infections, bacterial or viral, allergies, or irritants. Dry eye syndrome. Dry eye syndrome occurs when your eyes do not produce enough tears or the right quality of tears. It can cause discomfort, itching, and a feeling of dryness. Cataract. Cataracts is the clouding of the eye's natural lens, leading to blurry vision and difficulty seeing clearly. It's often age-related but can also result from other factors like injury or certain medications. Glaucoma is a group of eye conditions that damage optic nerve, often due to high intraocular pressure. It can lead to vision loss if not treated promptly. Macular degeneration. Macular degeneration affects the macula, the part of the retina responsible for sharp central vision. It can lead to a gradual loss of vision in the center of your visual field. Diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina, potentially leading to vision impairment or blindness. Retinal detachment. Retinal detachment occurs when the retina separates from the back of the eye, which can lead to vision loss. It is usually a medical emergency. Blepharitis. Blepharitis is the inflammation of the eyelid margins, often caused by bacterial infection or skin conditions. It can cause redness, irritation, and crusting of the eyelids. Sty or hodiolam. Sty or hodiolam is an infection of an oil gland in the eyelid, resulting in a red, swollen, and painful bump on the eyelid. Uveitis. Uveitis is the inflammation of the uvea, the middle layer of the eye. It can be caused by infections, autoimmune disorders, or injury, and can lead to pain, redness, and vision problems. To conclude this chapter, I'd like to end off with a note saying if you're experiencing symptoms or have concerns about your eye health, it's always best to consult with an eye care professional for an accurate diagnosis and appropriate treatment. Since there are a lot of rare eye illnesses out there in the world, I will only explain a few examples of them. So I only explained 10 rare eye illnesses like I did for the common eye illnesses. Keratoconus. Keratoconus, although not extremely rare, it's still less common than many other eye conditions. It's a progressive disorder where the cornea thins and bulges into a cone shape, leading to vision distortion. Stargardt disease. Stargardt disease is a form of macular degeneration that usually begins in childhood or adolescence. It affects the retina and leads to vision loss, especially central vision. Behçet's disease. Behçet's disease is a rare chronic condition that can cause inflammation in various parts of the body, including the eyes. It can lead to symptoms like uveitis, which can affect vision. Choroideremia. Before we talk about choroideremia, we must first understand what the choroid is, because I didn't explain this in the eye anatomy. The choroid is a layer between the retina and sclera that supplies nutrients and oxygen to the retina. Now that we understand what the choroid is, let's talk about choroideremia. Choroideremia is a rare genetic condition that causes progressive degeneration of the choroid, retina, and pigment epithelium, leading to vision loss. Labor congenital amaurosis. Labor congenital amaurosis is a rare genetic disorder present at birth that leads to severe vision impairment or blindness. Retinitis pigmentosa. Retinitis pigmentosa is a group of rare genetic disorders that involve a progressive degeneration of the retina, leading to night blindness and tunnel vision. Ocular albinism. Ocular albinism is a genetic condition where there's a lack of pigment in the eyes, affecting vision and causing problems with visual acuity and sensitivity to light. Eales disease. Eales disease is a rare retinal disease characterized by inflammation and abnormal blood vessel formation in the retina, which can lead to vision loss. Acanthamoeba keratitis. Acanthamoeba keratitis is a rare but serious infection of the cornea caused by a protozoan parasite, often associated with contact lens use. As we have now reached the end of today's video, I'd like to end off saying if you're having any eye problems or eye illnesses or diseases, not only limited to the ones mentioned in this video, because there's many more out there in the world, just go visit your eye doctor or like even your family doctor so you could get help and just like go for regular checkups for not only your eye but like for your whole body. I hope you all have a great day and you gain some information about the eye from this video. And that'll be all. Have a great day.